This is the eHealth Radio Network, your source for health advice on demand. And now your host, Eric Michaels.
Thanks for joining us once again here on the eHealth Radio Network. This is your host, Eric Michaels. eHealth Radio gives you the most current health information, news, and advice featuring some of the leading innovators in healthcare and wellness who are changing healthcare as we know it. For more eHealth Radio reports, we invite you to visit our main radio channel site at eHealthRadioNetwork.com. Today we're speaking with Shawn Amer, the Clinical Program Director at Central Ohio Primary Care. With more than 70 practices serving over 400,000 patients, Central Ohio Primary Care is the largest independent primary care group in the country. Shawn, thanks so much for joining us here today on eHealth Radio.
Thanks for having me.
And certainly our pleasure. So, Shawn, tell us, I understand that during the vaccine rollout, Central Ohio Primary Care launched a vaccine delivery service to vaccinate homebound patients. Can you tell us more about this initiative and why did COPC launch this program?
Yeah, absolutely. So COPC has been working hard since the vaccine became available to vaccinate as many patients as we could. We have a whole team who has set up these really wonderful clinics for patients to come get vaccinated. But one of the challenges that we had was that we have a population of patients who are homebound or very home limited and cannot get out to a vaccine clinic or even oftentimes to their doctor's office. They would require medical transport like an ambulance or a stretcher to come to take them somewhere. So what we wanted to do was to set up a vaccine program to address patients with those needs. So we have a group of nurses. It was really, the charge was led by the lead for our home and palliative care team nurse. Her name is Jamie Bowersock, and Jamie developed a program where we would receive referrals from our primary care docs in their offices, and we would call the patients to do a screening assessment, ask them questions, confirm which vaccine they would like to receive. And then we worked to put together routes where a team of nurses went to the patient's home, got the consent provided, also some education on the vaccine, gave the vaccine, and then they would have to wait the requisite amount of time, whether it be 15 to 30 minutes, depending on the patient's allergy and health history. And then we would come back for a second dose a few weeks later if they had elected a Pfizer or Moderna vaccine. So there was a lot of logistics involved as we worked to identify these patients, call them. Part of the difficulty in scheduling visits in the patient's home is obviously coordinating the driving routes and the mileage, and then also working with caregivers as well. Many of these patients are patients who are bedbound and not able to physically answer a door, and so we would have to work with the families and caregivers to be able to get into the home and to see the patient.
Well, this is quite outstanding, the initiative that you have in place, and certainly appreciate what you're doing locally and in your region as well. Now, what are some of the hurdles that you have encountered in vaccinating homebound seniors, and what success have you seen through the program so far?
Yeah, so it is sometimes difficult. Something as simple as reaching the patient and having a good phone number for the patient or family. Sometimes our older patients have been kind of coached in certain places not to pick up the phone, right? And if they don't know the number. So sometimes even reaching the patients can be difficult. We've often also seen some different challenges where, and this is in particular for our dementia patients, where the family caregiver or the healthcare power of attorney wants to have the patient vaccinated for all of the public health reasons that we know, but when the nurse got to the home, the patient was not keen, and understandably so, on having a stranger come into their home and to try to give them a shot. So we had a couple of challenging situations where the patients, and these happened to be patients with dementia, decided that they did not want the shot, even though their family was very keen on them getting that. And so those are obviously in those situations we can't force it, and we can try again at a later point if the patient's having a better day. Some of the other the successes that we've really seen in the program, it's been really quite wonderful. We've vaccinated 91 patients to date, and 50 of those patients actually got a Pfizer or Moderna vaccine, which required us to go out and do 2 trips, and 41 of those had Johnson & Johnson. But we've seen a lot of really happy patients and caregivers. These are patients that, they're not out and interacting with the public like you or I might, but they have lots of different family members, caregivers, community health workers who are coming into their home, and so it's still really important to be vaccinated. And so many of these patients were really happy to feel like that they were doing their part to fight back and to protect themselves and their families.
Yeah, certainly appreciate the report and feedback, and certainly can understand the challenges that you incurred on that as well. I'd be curious, how has this program been meaningful to you and your team at Central Ohio Primary Care, and is there a patient experience that was particularly memorable as well?
Yeah, so we have been with our home vaccine initiative. We've been relying on the wonderful support and time from many of our nurses across the organization, not just in our home team. And so these are nurses that have, it's been really meaningful to them. And every time we, chat with them after they go out and on a vaccine route, they're super excited to have seen the patients and gotten to interact with these folks in their home. It's a nice thing to be able to meet patients where they're most comfortable, and to see the joy that they have in being able to do their part and to get vaccinated. So it's really been really exciting, and I think heartwarming for a lot of our team members to be able to go out and to take the vaccine to patients who thought that they might not be able to get it. We had one experience in particular. We had a patient who was well enough to be able to get vaccinated early on in late January, and then in between that first vaccine and when they were due for their second vaccine, had to be hospitalized, and they went to a skilled nursing facility. And when we called them after they had discharged from the skilled nursing facility and they weren't able to get into the office or the clinic, they were super excited that we hadn't lost them, that they could still get their second dose and get fully vaccinated, even though they could no longer get back into the office. So it was, I think, a really heartwarming for all of the people that worked on that particular patient's case, and it was important for us to be able to follow them over the course of all of their healthcare journey to be able to get them fully vaccinated in the end. So that's the story that I think sticks out the most.
Well, I'm certain it's been an incredible experience so far, and again, we're really thankful for what you're doing in your region today. We're speaking with Shawn Amer, Clinical Program Director at Central Ohio Primary Care, with more than 70 practices serving over 400,000 patients, and is the largest independent primary care group in the country. She's joined us here today on eHealth Radio's Health Care and Health News channels, a part of the eHealth Radio Network. Now, Shawn, I understand that COPC has launched other initiatives for senior patients during the pandemic to make health care more accessible. Can you tell us more about these other efforts?
Sure. So in addition to our vaccine delivery service for homebound patients, COPC has launched Senior Access. We did that because we noticed that for many of our seniors, finding a primary care doctor was a challenge. So seniors sometimes called multiple practices only to find that the physicians there are not accepting new patients, or the doctor's office, if they were accepting patients, they might have been in an inconvenient location a far distance from their home. And we know that can be incredibly frustrating, and the process can take, in some cases, weeks to months. So in some cases also, we found that seniors will just kind of give up or delay their treatment because the process is time-intensive and frustrating. So that's why COPC launched Senior Access, because we believe that finding a quality health care should be easy, and that every senior deserves to have a strong relationship with their doctor. In addition, in collaboration with COPC Senior Care Advantaged, we launched the Senior Access, which is the internet site to make the search for primary care simple, so any senior can fill out their information on our site, and we will contact them within 24 hours to schedule them for a new appointment.
Now, speaking further on Senior Access, what are the benefits to Senior Access, and who is actually eligible for the program?
Sure. So our goal is to increase access to primary care for the most at-risk patients, which are our seniors. We hope that by connecting more seniors to primary care doctors, we'll be able to address medical issues earlier, so patients don't have to take unnecessary trips to the emergency room. And we really hope that we can connect Columbus seniors to doctors with whom they will have long-term, happy and productive relationships. So any senior over the age of 60 is eligible for the program, and they could visit the website www.copcp.com/senior access to be able to get to the website and find a primary care doctor who's accepting patients in their area.
I certainly appreciate all the details on Senior Access and the program there, and folks, you'll certainly want to visit the website mentioned to get further details. In conclusion, is there any closing thoughts, a takeaway, a tip, or anything else that you'd like to share as we wrap things up here today?
I appreciate your time, and I think that even beyond the crisis of COVID, it's really important for us to remember our homebound and kind of home-limited senior population, and to always be thinking about how we can make sure that we're delivering and getting good health care to them as well. So really appreciate the chance to talk about all these initiatives.
And you're certainly more than welcome. Our pleasure and honor to do so. Again, folks, for more information, simply visit COPCP.com. And of course, we'll leave this link within the show notes of this broadcast to further aid as well. Shawn, all the best, and thanks for joining us here today on eHealth Radio.
Thank you so much. Take care.
And you as well. We've been speaking with Shawn Amer, Clinical Program Director at Central Ohio Primary Care, with more than 70 practices serving over 400,000 patients, and is the largest independent primary care group in the country. And again, for further details, visit COPCP.com. And again, this has been your host, Eric Michaels, and we do thank you for your continued support of the eHealth Radio Network. Join us again soon for another episode that will help further expand your knowledge on those things that are important to your health and wellness. For more eHealth Radio reports, we invite you to visit our main radio channel site at eHealthRadioNetwork.com. And as always, we do thank you for tuning in.
Thanks for tuning in to the eHealth Radio Network. For more information or to subscribe to this podcast, visit eHealthRadioNetwork.com.